Many people worry when their memory slips a bit with age, but not every forgetfulness is a problem like dementia. Mild cognitive impairment, or MCI, is when memory or thinking problems are greater than expected for the age. Yet the daily functioning, the activities of daily living for individual is quite independent. It's a bridge between normal aging and dementia. For instance, a transition process from normal aging and entering into dementia. And the key is early detection. With timely assessment, brain-healthy lifestyle changes, and targeted care, we can often slow the progression and protect cognitive health. If you or your loved one notices a persistent memory lapse, then don't ignore. Early evaluation and assessment makes all the difference. Subtle memory changes are often the first clue, like repeating questions, forgetting recent conversations, being repetitive about things, asking questions again and again, and looking for appointments or losing track of the appointments, bills, bank statements. People may struggle with planning, decision making, organizing stuff, and finding the right words, groping for the words, looking for the new words, mispronunciations, sometimes misplacing the words. Though they're all still managing their day-to-day lives quite well. These changes are more than just an aging problem. They are the ones who are giving you signals that there might be a problem. If you notice the pattern in yourself or a loved one, get a professional cognitive assessment early, because timely care can truly make a difference. Diagnosing mild cognitive impairment isn't about a single test or investigation. It's a careful, step-by-step evaluation of the condition. We start with a detailed history, which includes the history of past circumstances, medical history, family history, and personal history. There are some standardized cognitive assessment tests that look into the memory, attention concentration, thinking skills, and visuospatial skills. Physical and neurological examination will be required, along with the blood tests and brain scans. That is mainly to rule out and help come to a conclusion if the cognitive impairment is because of any other cause, such as thyroid functions, a deficiency in vitamin B12 or folate, and vascular issues. It's a clinical diagnosis, best made by specialists who understand both aging and brain health. Because earlier we detect, it is better we can protect cognitions. Mild cognitive impairment can affect anyone, but there are certain factors that put some people at risk. For example, advancing age is one of the biggest risk factors, but it is not the only one. People with diabetes, high blood pressure, and some heart conditions, who also have a family history of dementia, are at higher risk of developing mild cognitive impairment. So, there are some of the physical health factors, such as being inactive, sedentary lifestyle, that can put people at risk of developing mild cognitive impairment. Also having poor sleep, having chronic stress for a long time, depression or low social and mental engagement, and very aloof or solitary lifestyle can also put people at risk of developing mild cognitive impairment. The good news, many of these are modifiable. By managing health, staying mentally and physically active will help the situation. Absolutely, lifestyle makes a huge difference. Research has shown that what is good for your heart is good for your brain. Regular physical exercise, Mediterranean diet style, good sleep hygiene, staying socially and mentally active will all help slow down the cognitive decline. Managing blood pressure and other physical health conditions such as diabetes, high cholesterol levels, and stress is equally important. There's growing evidence to suggest that right habits such as early medical guidance, People with MCI can maintain function and independence and a good quality of life for years. Small changes today can protect your brain tomorrow. Occasional forgetfulness is normal, but if memory lapses become frequent, if you become repetitive in questioning, ask a lot of questions again and again, struggle to follow conversation, lose your way back home, or you lose your way in the familiar places, or notice changes in judgment, decision making, planning, organizing skills, it's time to get checked. Don't wait for the symptoms to get worse. Early evaluation and assessment help us find answers to the problems, and things can be reversible. Mild cognitive impairment can be detected early and protect your brain health. If you or your loved one is concerned, talk to a specialist. Timely assessment can make all the difference.